I'm Ebony Carruthers, the Assistant Communications Director of the Student Special Interest Group for the Section on Women's Health. And today I'm here with Stephanie.Bush, the Residency Director of Brooks Rehab Women's Health Residency. And I will be interviewing her over the residency there. So, hi, Stephanie.
Hi, how are you?
I'm good. How are you?
Good, thank you.
Well, the first question is just about the basic logistics of the program. So, can you tell us a little bit about the start date, how long it is, application due dates, etc.?
Sure, yes, I can. So our residency programs, all of them, and in particular the Women's Health Residency, is a year-long program. It starts in July, it ends in July. So for this upcoming residency year, I believe the start date is July 10th, and then it's an entire year until the next July. The program typically consists of a combination of didactic learning, clinical mentoring, and directed learning activities for each of the residents throughout the year. Typical classes are held weekly when it comes to women's health specific didactic material. So we hold those classes weekly. Sometimes we'll hold them on the weekends as well. And then each resident does receive 150 one-on-one clinical mentoring hours with a women's health specialist, which would be myself at this time. So these are kind of some of the starter basics of our program.
Okay, and when is the application due date?
The application due date specifically, I don't know the exact due date. I should know that, but I know believe it's the end of February for this year.
Okay, and how long has the program been around? How many residents have you taken?
So this is my second year as the Women's Health Residency Coordinator. So I came on board to be the director for this program 2 years ago. So this is my second year. Last year we had 2 women's health residents who graduated successfully, and this year I have 2 as well.
Okay, and do you know how many of the residents have passed the WCS exam the first year after residency?
So within my current classes that I have been coordinator over, my 2 residents from last year are getting ready to sit for their WCS in March. I am actually one of the original women's health residents for our program at Brooks Rehabilitation Institute of Higher Learning. And in my residency class, there was 2 of us and we both passed our WCS.
Okay, so there are usually 2
anywhere from 2 to 3. It just depends. Obviously, we want to make sure we find the right fit, but we do have 2 to 3 different locations where we can place women's health residents.
Okay, and let's talk about the applications. What does the ideal applicant to your program look like? Is there certain experience or prerequisites that you require or look for?
Yes. So in particular, when it comes to applying to our women's health residency program, we do require that the applicant has already taken pelvic 1, so entry level of pelvic floor rehabilitation. I think that just really helps to prepare the applicant, as they're getting set up and going to their residency, that they've already had some exposure to some basic pelvic floor related issues and pelvic floor anatomy. So that is a requirement. It would be nice to have OB1, but that's not a requirement as well. Particularly, obviously, to be licensed to practice in the state of Florida. And another requirement is that as an employee of Brooks Rehabilitation, that they meet all the employment requirements as a practicing physical therapist at our organization.
Okay, and do you accept new grads?
We do. Yep, we accept new grads. Yes.
Do you recommend new grads apply? Like, what do you think is the best time to do a residency? Right after graduation or after having some clinical experience?
So I think having a little bit of clinical experience can be really helpful for the resident. I think, as a new grad getting out of PT school, you're kind of now really learning how to be a PT. You're getting oriented to managing a caseload, learning, keeping up with documentation, billing, all those standard practices as a practicing physical therapist or wherever you're working in the outpatient setting. So I think that's helpful just to kind of build confidence and most importantly, to just get some exposure to treating of different types of diagnoses. And then again, as a requirement for a residency to already have pelvic 1, I think it would be nice just to have some exposure with dealing with those entry-level pelvic floor dysfunctions, such as like urinary incontinence or prolapse or something of that. So, but last year, both of my residents had about 6 months to a year experience. this year I have a new grad, and my other resident has about 3 years of experience, and they're both, everyone has done great and is doing great. So I just think just to help get oriented just to a program and just kind of getting your feet wet and learning how to manage a caseload and all those things as just that you're starting to experience as a new practicing clinician, it's good to maybe have some of that experience before going into a residency.
Okay. And what is your selection interview process like? When does the interview typically fall? And do you have any tips on how candidates can do well during the interview process?
Yes, so typically our interview process happens in stages. So, and particularly last year, what we did is that candidates, after they apply, candidates are chosen to do what we do kind of like this, a little mini live interview where there'll be a set number of questions specifically related to why the candidates applying to our program, what is it about women's health that has sparked their interest. And so they will answer those questions. They're one-way interviews. And then after a one-way interview, once chosen, then the candidate will then move on to a live interview. So we have a live interview day where the candidate can come, and it's a nice opportunity to get to see the organization, to get to meet not only myself but other residency faculty members, and then be interviewed at that time as well. And so that's typically our process. And then after the live interviews is when applicants are chosen.
Okay. Would that generally be, what month would that fall around?
So that falls in April.
April. Okay. And when are residents notified of their status, or candidates notified of their status? How soon after the interview process does it take?
So it's pretty timely, I would say, after we've gone through the process and after the candidates have gone through their live interviews, and as the residency coordinator, then the decisions are made if we're chosen, and then I will contact the candidates personally to let them know. I would say as soon as maybe a week. Typically would like to be pretty timely and promptly, knowing that, the residency year is getting ready to start in July. So.
Okay. And can you tell us what you think is unique, or maybe what stands out about your residency from the others?
Yes, I feel what's really neat about our residency program is that not only is the women's health resident getting a lot of just in-depth learning when it comes to women's health specific and pelvic floor specific related diagnoses, but we also provide a really strong musculoskeletal orthopedic foundation. I think as a women's health pelvic health therapist, orthopedic skills are really important. So I think that's something that we offer that typically maybe a lot of other programs don't, is that orthopedic musculoskeletal foundation, in addition to the advanced women's health pelvic floor clinical skill practice as well. I think something that is also unique to our program is that not only with women's health residency program, but we do have 5 other residency programs. So we do offer foundational courses. Typically that happens in the beginning of the residency year within the first 2 months. So it's a nice opportunity for all residents of all specialties to come together to go through classes and kind of meet each other and kind of go through that foundational course experience. And that would include like evidence-based practice, clinical reasoning, research. So those types of foundational courses everyone goes through together. And I think that's something a little bit unique and different that we offer as well.
Okay. And do the women's health residents have the opportunity to work with the other residents?
So there is, yes, in the sense of depending on where the residents are placed, we do have facilities that have more than one resident within a specialty area. So an example could be currently both of my residents are working with other residents of other programs. So in particular, orthopedic and like pediatrics. So that's also a nice opportunity to be able to go through that residency process. Utilize your other co-residents of maybe other specialty areas to kind of clinically reason, bounce ideas off of. So I think that's a unique opportunity as well.
Okay. And you said there are different clinics that residents could be exposed to or placed in. What are the settings? What types of settings are there available?
So for women's health residency in particular, it's an outpatient setting, and it's there's no rotation within the women's health residency. That resident fulfills their entire residency at that one particular outpatient facility.
Okay. And you talked a little bit about the curriculum.
Yes.
So how many hours are the residents in the clinic versus in class? Or is all the didactic work kind of at the beginning, and then how's that set up?
Yeah. So as a resident, part of our program is that you are working your 40-hour clinical work week. And then typically, specifically to women's health, or women's health residency classes are held on Friday afternoons. Sometimes we'll have weekend courses as well. That's kind of dispersed throughout the residency year. But every week, typically a 4-hour women's health specific didactic class on Friday afternoons. And then again, typically there might be an occasional women's health advanced specific course held on the weekends. And then each week as well, that's when the mentor will receive 4 hours of direct one-on-one clinical mentoring. So I will go to the resident at their respective residency location, and then we'll mentor at that time. So that's typically, and that's pretty consistent throughout the whole year.
Okay. And are there any teaching opportunities or research opportunities during the residency?
Yes, there definitely is. So within our residency program, each resident is required to write 2 case reports. They are also required to do 3 case presentations. And with that, working with each resident, it is making sure that preparing their case report and case presentations is something that they would want to move on forward to, like either present at a platform presentation at CSM, or like one of their case reports to submit for publication. So we do encourage those sort of activities to facilitate that professional development. And then what was the second part of your question?
Teaching opportunities?
Yes, there is. So we do have relationships with local universities here, to where there is opportunities provided to teach to those organizations. So, for example, there is a great the Florida State Community College here. There's an opportunity to go and to teach to one of their classes. And then we have the University of North Florida here, and there has been opportunity as well to go and teach a class there. So teach a lecture. So that's really a neat experience to get to prepare for and then to perform.
And are there any international opportunities, either residents from the states doing work internationally, or even do you accept international students? Or
so I will say, in my 2 years that I've been here, there hasn't been any international opportunity as a resident to go outside of the country to perform some sort of directed learning experience or activity or clinical experience outside of the country. But it is our application process is open to everyone. So the requirement would be at least that they are able to practice, have a valid license and able to practice in the state of Florida. 1 year I did have one candidate who was living in Ireland, and so she applied to our program.
Okay, and a little bit more about the mentoring. You said it was 4 hours every Friday afternoon. How are they structured?
So when it comes to the mentoring typically will take place during the week, and it will be during the residents' regular clinical productivity hours within their clinic. So obviously I will schedule ahead of time with each resident each week that 4-hour session or block that I will go to their clinic, and they are actually treating their patients, and it's a great opportunity for me to then provide mentoring, feedback, a little co-treatment as needed during their real lifetime clinical practice experience as they're working with their patients.
Okay, and you said that ortho is pretty incorporated into the program. Mm-hmm. What about men's pediatric sports patients? Do you see those types of patients?
Yeah, so as far as the orthopedic portion, we do hold throughout the year is specific orthopedic manual skill development courses that are held basically starting at major body parts: cervical spine, lumbar spine, thoracic spine, upper lower extremity. So that's a set nice foundation that we just make sure that the residents have developed their skills in and refined their skills in. And then again, specifically to the women's health, we definitely do treat, and we do have exposure and experience with male and female pelvic floor dysfunctions, disorders, such as pelvic pain, any sort of bowel bladder dysfunction. We do have a section of didactic material dedicated to the female athlete, to fibromyalgia and chronic pain, to osteoporosis, to breast cancer rehabilitation, to lymphedema management. So we do cover all of those. Big part of it is obstetrics and postpartum, including high-risk pregnancy. So those are all the women's health related and pelvic health related coursework that we're covering throughout the year.
Okay. And pediatric as well?
Yes, pediatric as well. Yep.
Okay. And what certifications would a resident receive at the end of the program?
So once they graduate from our residency program, so they are obviously receiving their certificate of achievement that they have are residency trained in the area of women's health. And I say that I really feel that the women's health residency program is great preparation for them to move on to be able to sit for their WCS.
Okay. And so let's talk about Florida.
Yes.
What is the area that the residency is located? How is that? How would you describe that?
So our residency is locations are located in Jacksonville, Florida. So it's the northeast part of Florida. As far as it's a great city, depending on what location. Jacksonville is a really interesting city because you have like the beaches nearby. You have a really nice downtown area. So weather's also nice. So anyone from up north typically would love to come here because it's a little bit warmer weather. But what's nice is within our organization, we have our main hospital, the Brooks Rehabilitation Hospital, and then we have our associated outpatient clinics and facilities. So the Brooks Rehabilitation Hospital is a nice central location. That's typically where we'll hold our Friday afternoon classes and our weekend courses and weekend classes there. So everything is fairly, within a nice kind of reasonable distance within each other, and then getting that exposure to being able to, attend classes at a rehab hospital. And then obviously they're working at their respective outpatient facility and location.
And are residents able to find housing pretty close nearby? And how's the cost of nearby to the residency locations? And then how's the cost of living?
Yes, I would say at our women's health residency locations currently, there is apartments, condos, living very close nearby. And I would say the cost of living here is fairly reasonable. So I know each one of my residency classes, all residents were able to find housing that was very economical and feasible for them for the entire year, and within pretty close distance to their respective clinics.
Okay. And do the residents receive a salary?
So yes, yep, they do receive. So basically you're coming on board as a Brooks employee and you're receiving a biweekly salary.
Okay. And so what is the likelihood of being hired on as a full-time PT after completing the residency? Is that something that you prefer or even have opportunities for the residents to do?
So I would say we are an organization that is obviously quite growing, and there's lots of opportunities. So I think that's another neat experience is as a resident's going through our programs and organization, opportunities just to participate in coursework that the organization itself provides, and different activities that our organization does, having the opportunity to be involved in that. And I will say, just from my observation in the past 2 years, there's definitely been opportunities for residents that have graduated, if they're wanting to stay on with Brooks, they're more than welcome to apply for those opportunities. And some of them have stayed within the organization, maybe not at their respective clinic, but maybe in some capacity or some way.
Okay. And what would you say is the residency's biggest area of growth, or something that you are working on to grow the program?
Oh, that's a good question. I would say as far as particular areas that I would like to see grow, the area of breast cancer rehabilitation and lymphedema management. We're in the process at our organization right now really growing our oncology rehabilitation services that we provide just as a whole. So I think that's a really neat opportunity for women's health residents to kind of be exposed as we're going through that. So that's definitely one area I would like to see grow. And then I would say, I'm a huge advocate of our directed learning activities. So those encompass like the resident being able to go observe a urogynecological surgery, go over, spend the day where they're observing urodynamic testing, for example, maybe spending the day with a doctor doing rounds. So I'm a huge advocate of those kind of activities and how that complements the didactic material and their clinical practice experience they're getting. So I'd love to see continued growth in those relationships to have those opportunities.
Okay. Well, thank you so much for spending the time and answering all the questions for us.
Sure. Thank you for the opportunity. I appreciate it.
Bye.
Bye.